I've heard you talk about DCIS a couple times today, and when I first got my diagnosis, we knew I had triple negative breast cancer, but upon closer examination, we realized there was another tumor about an inch away that was DCIS. What is DCIS? Can you explain that to us?
Sure. So DCIS stands for ductal carcinoma in situ. And it is breast cancer, but it is confined to the duct. It does not have the capacity to bore down through the duct into the fatty part of the breast. When that happens, it changes from infiltrating ductal carcinoma. So ductal carcinoma in situ is confined to the duct, doesn't get into the fatty part of the flesh, and does not have the capacity to get into blood and lymph and circulate around. It is called stage 0 breast cancer. And the focus of treatment is to get it out of the breast. But this is a woman who does not have a death rate attached to her cancer because it doesn't metastasize. So you might say, well, why treat it? Well, you treat it because if ductal carcinoma in situ is left in the breast over a period of time, and time is a little bit of a question mark, but it can be anywhere from 2 to 10 years. If that's in there, not detected, then some of those morph into invasive ductal breast cancers. So it is the very earliest breast cancer, and it has local issues only. It doesn't have the capacity to metastasize and kill a person.
Well, that's interesting because I mean those can stay in there then and but could become problematic later. It brings up another question. I mean, there's so much debate over when we should start mammograms. 40, now there's this suggestion of 50. I think we'll lose many, many lives of American women if we just arbitrarily put it to 50. But I got another question that I hadn't actually thought about. When is it safe to stop having mammograms?
So this is another great question, and this is a hard question. This is a very hard question. So what the last U.S. Preventive Task Force said was that women who are 70 to 75 years old, they suggested that women in that age group should engage their physicians in a discussion about the risks and benefits of getting mammograms. So here's the rub. Breast cancer is a disease of aging, okay? For most women, it's a disease of aging. And in fact, if you look at the rate of breast cancer between age 60 and 70 and between 70 and 80, it's higher than between age 40 and 50 and 50 and 60. There's more of it because it's a disease of aging. But, if we are detecting DCIS, stage 0 breast cancer, in an 80-year-old woman, are we really doing her any favors? If we never knew that 80-year-old woman had DCIS, what would be the natural history of that DCIS? Well, over a period of probably 10 years, it might morph into a very early invasive ductal breast cancer, and even that might take another 10 years to actually have the capacity to circulate and cause metastases. So that maybe that's going to happen when she's 100. Point being, maybe we're treating too much early stage breast cancer in older women that never was going to be relevant to their health. And worse than that, then you've had a surgical procedure that has side effects, infections. A lot of older people are on blood thinners, so then we get complications with bleeding, anesthesia issues, because older people have more other medical problems. And so in that age group, is treating early stage breast cancer really a benefit to the person? And this is what and there's no answer right now, because for every woman that, you know, you think you have it figured out, and then there's that like 78-year-old woman who has a triple negative breast cancer that if you missed it, you know, maybe she would be gone from the planet by the time she's 79. So it's a huge issue. And, you know, I think if you are not a person with breast cancer and you don't have a family history of breast cancer and you have had a mammogram every single year from age 40 to 70 and they are all normal, well, you maybe are a person who could cut back on your mammograms or maybe even consider not doing them. But if you have a family history, if you are a breast cancer survivor, it's very hard to not have that mammogram. I think the one place where women are willing to accept this, when to stop having mammograms, is if you would say, you know, I have these other medical problems, and I wouldn't want a surgery. I am not healthy enough to have a surgery for an early stage cancer, so therefore, why am I doing a mammogram? So I think, you know, physical health plays into it too. It really, for older women, you know, you need to talk to your primary care doctor about it. And that is, I know primary care physicians want to do it, but it can be a long and complicated and heartfelt conversation. So where do you get this information? You know, the hospitals, most of them have breast care centers and have nurse practitioners who are very well versed in this and can help women make those choices. There's no clear answer.